Ho, ho, ho. Happy Thursday, December 14th. Not quite Christmas yet. Those of you celebrating any of their holidays, happy all of that to you too. Awesome. Let's get this thing going, guys. Good evening, everybody. I'm Dr. Joaquin Acosta, your guide and host on this enlightening journey to the Know Your Pharmacist Livestream. As the CEO of Pharmtrue, I'm here to bridge the gap between advanced healthcare and you, our cherished community. Tonight, we're embarking on a captivating exploration into the realms of cognitive health and holistic wellness. In our Pharmacist Frontline segment, we'll delve deep into the latest innovations in brain health, spotlighting the groundbreaking BrainCheck platform there into our Tech Talk segment. This tool isn't just a technological marvel, it's a beacon of hope, offering a new perspective on cognitive assessments and care. So the world BrainCheck is creating is very cool. We're going to explore the profound impact in our Enlightenment Hour, taking a turn towards Alzheimer's, talking about Alzheimer's in the term of type 3 diabetes. Here we're going to discuss how this condition, deeply intertwined with metabolic health, opens the doors for preventative measures and lifestyle changes, guys. In the Herbal Wellness Corner, we're going to integrate our discussion on dementia care with the innovative approaches of Pharmtrue and High Horse Cannabis Company. I'm going to show you guys a little bit of our caregiver guide for patients with dementia or other neurological disorders. It's not just about treatment, it's about education, understanding, and embracing a holistic lifestyle. Community Spotlight shines on the roasted Rooster coffee and waffles tomorrow, having their grand opening over there at their location on Amador Drive from 3 to 7. Casa de Peregrinos collecting cans as well for the homeless. Their efforts, guys, local efforts, remind us of the power of unity and the strength we draw from helping each other. Finally, in our Men's Health Minute, we're going to focus on the heart and core of our well-being. Understanding and managing heart health is crucial, and we're here to guide you through it. Tonight is not just another live stream, guys. It's a journey towards empowerment, understanding, and wellness together. Let's explore, learn, and grow. So sit back, engage, and let's transform our health narrative together. Welcome, guys, to the Know Your Pharmacist live stream, where knowledge meets action and wellness becomes a reality. So let's start this thing off tonight. Pharmacist Frontline segment, guys. So when was the last time anybody had a, Alzheimer's evaluation, mental health and cognition evaluation, especially if it may be that time, guys? Early screening is a very, very important thing. We're going to talk about a whole lot of different angles here. I'm going to, go over this one here from Skip Pack Pharmacy. Just going to walk you through some of the things that I do like, from here, and we're going to segue it in all the way down to, cannabis options when it comes to dementia and Alzheimer's, right, guys? So I'm going to take this down, looking, guys, Alzheimer's disease, it's the 7th leading cause of death in the United States, according to the CDC. Roughly 5.8 million Americans are currently living with Alzheimer's, and the number is projected to nearly triple to 14 million by 2060. Impact of this disease, guys, obviously it's devastating. The costs are staggering. But again, as we'll talk about it in the light of type 3 diabetes, big time byproduct of excessive and poor sugar metabolism, on top of other things. Alzheimer's disease is the most common cause of dementia condition affecting the brain, causing problems with thinking, memory, and behavior. It's a progressive disease, meaning it can get worse over time. Doesn't mean it's not reversible either. So especially with that early detection, guys. So do you know that the disease is named after Dr. Aloy Alzheimer, who in 1906 observed changes in the brain tissue of a woman who had died to an unusual mental illness? The symptoms included memory loss, language problems, and unpredictable behavior. After her death, Dr. Alzheimer examined her brain and found abnormal clumps and tangled bundles of fibers. These structures, now known as amyloid plaques and neurofibrillary or tau tangles, respectively. So, warning signs. What are we looking for, right? It's not just a normal part of aging. There's 10 warning signs that are definitely, more indicative than nothing. So anyways, Memory loss, disrupting daily life, forgetting events, repeating yourself, or relying on more aids to help you remember. Challenges in planning or solving problems, having trouble paying bills or cooking recipes you've used for years. Right? You have a body of work on yourself to be able to notice. Difficulty completing familiar tasks at home, work, or leisure, or again, on the other side, if you're a caregiver, noticing this in somebody else's life, right? Confusion with time or place, trouble understanding visual images or spatial relations, new problems with words and speaking or writing, right? Having to figure out what you're saying, it's on the tip of your tongue, the thing on your wrist that tells time instead of watch, right? Misplacing things and losing the ability to retrace steps, decrease poor judgment, withdrawal from social activities, and changes in mood and personality, right? And a lot of these things we can contribute to are seemingly, ongoing, crazy daily lives. However, again, as we'll talk about, and I hope we have a better understanding in our empowering cognition episode tonight, that this is something that can be a little bit more preventable, identifiable, obviously, by processed foods, by the nature of what's on the shelves these days and the amount of sugar we consume, especially in the different, crazy processed forms, so on and so forth of them, guys. Our bodies are not meant to process that much glucose over that much time, especially with the amount of inactivity that a lot of us humans tend to build up on. So where that body could be a little bit more efficient, we're going to identify some of those points as well tonight, for sure, without this isn't a shame battle, this isn't anything like that by any means, guys. So let's jump into the tech talk portion of this. An app, guys, called BrainCheck, talking about cognitive health assessments for anybody who might be looking for a cognitive health assessment. If your provider has not already put you through something in particular, this is a cool one that's relatively progressive right now. The BrainCheck platform, improving patient outcomes through, again, comprehensive cognitive care. It's going to keep different data points for providers in specifics to, all of these things. And it's going to work with patients to make sure that these are always getting addressed, right? So, we'll basically, show you right here, cognitive assessment. It's looking at, do our memory complaints actually work, statistically, something that might be viable here, again, and it's going to actually give you the delayed recognition test and immediate recognition test, attention test, executive function test. So good way to really get that evaluation there on those who might be, not only Alzheimer's, dementia, but even diabetes, pre-diabetes, as we will, continue to address here. So BrainCheck app, pretty cool if you haven't heard of it, or if you haven't taken a cognition assessment or thought about it, or maybe your family members may be due for one and then you think it's a good idea. Hey, well, so-and-so seems a little off. Maybe, the cognitive side of things in terms of dementia could be always an underlying factor. So something we want to address here today for sure, especially as people are gathering for the holidays, getting ready to see all your friends and family, especially those you may not have seen for a while in our elderly population, some of our most vulnerable there. So let's talk, guys. Type 3 diabetes. Check this out. A couple facts here about Alzheimer's and metabolic health. Let's go through it. Alzheimer's, often termed type 3 diabetes, is linked to poor metabolic health, increasingly seen as preventable, especially in these integrative functional medicine lenses, right? By understanding and managing underlying biological factors. Again, dementias, we're talking about it, including Alzheimer's. Yes, it's rising rapidly. Estimated over 40 million adults living with dementia will triple to 57 million and 153 million in 2050, guys. So billions invested in research. Over 400 studies out of the big main studies have yet failed to yield an effective drug that treats Alzheimer's, right? So we see some of the traditional stuff that's out there, but it doesn't reverse Alzheimer's. It may slow down some of the symptoms, and it may kind of depress some of the expression of the symptoms. But again, how valuable is that, right? Still, again, so what is this correlation between insulin resistance and brain health? New Mexicans, right? Significant cause of Alzheimer's is insulin resistance in the brain. Poor dietary habits, high in sugar, carbs, right, contribute to it affecting brain function. So, we know studies like the finger trial. You guys want me to show you a little bit of this? Give me 2 seconds to do this up for you. But anyways, the Finnish geriatric intervention study to prevent cognitive impairment and disability. It's a multi-center randomized controlled trial that affects the lifestyle interventions on cognitive decline. The trial was first launched in Finland in 2009, currently still being conducted in 6 areas in Finland. So the study does include components on dietary guidance, physical activity, cognitive training and social activities, intensive monitoring and management of metabolic and vascular risk factors. Guys, the finger trial has reported significant beneficial intervention effects on global cognitive performance. So this is one of the relative bigger trials here in terms of actually supporting the reversibility of, again, Alzheimer's. Those of you who may think that this is something that's you're 100% glued to just because of your DNA makeup, think again, really. So looking at, right, the finger to worldwide fingers trials here, coming out here, just literally going to take you guys down to some of the results and conclusions. We don't need to do an entire journal club right now, but some of the cool stuff, because a lot of the times we only see American data, right? And so thank you, Finland, for this. So prevention has recognized as pivotal in halting the expected worldwide increase of Alzheimer's disease and dementia cases. Successful preventative approaches should be feasible, accessible, cost-effective, and sustainable for populations in geographical, economic, and cultural settings. Several modifiable risk factors which can be managed to promote brain health and reduce the risk of late-life Alzheimer's disease and dementia have been identified. Yet, the majority of the observational studies on risk and protective factors have been conducted in high-income countries, with few findings available in low and middle-income countries, which are facing the highest rise of dementia prevalence and incidence. In fact, right, by 2050, according to this, 68% of all people with dementia worldwide are expected to live in low and middle-income countries. The WHO has invited experts, right, to produce global action plan guidelines for cognitive decline and dementia risk reduction. But as we're talking about these things, right, lifestyle factors, diet, really being big correlators there to dementia. And again, social determinants of health there is what we're talking about. So efficacy in other age-related chronic conditions that help to facilitate the reduction of dementia risk by addressing the multifactorial, complex, and heterogeneous nature of late-life cognitive impairment include diabetes mellitus, cardiovascular disease, right? Very, very important to consider that prevention on, again, a large scale for all of that. So not only are we looking at the associated costs with maybe someone who's diabetic or maybe someone with heart failure, guys, we're also looking at, everything else that stems from that. Alzheimer's is going to be its own independent, number on the financial scorecard there. It's not going to be linked to the diabetes, spend. So where we're looking at that, guys, I mean, again, if we were to get ourselves out of some of those problems, pre-diabetes, diabetes, we would be reducing our risk for dementia, for Alzheimer's disease, reversing some of this cognitive decline that we are seeing. On top of that, guys, there's also neuroprotective effects from cannabis when it comes to this, right? Alzheimer's disease, again, most common form of dementia, and the disease process can begin years or decades before symptoms emerge. Again, we all know approved treatments right now for Alzheimer's disease are woefully inadequate, to say the least. right? Vascular dementia and Lewy body dementia are the second and third most common causes of dementia, both sharing some features with Alzheimer's disease, but also have distinct symptoms. An accurate diagnosis is important because one uncommon form of dementia, normal pressure hydrocephalus, can be actually reversed with surgery. So again, guys, cannabis can be an effective thing here when we're talking about dementia and introducing it. So why, is this a thing? Well, again, quality of life, behavioral symptoms like agitation and aggression, these are all observed when in, patients in dementia, Alzheimer's. Pain, anxiety, sleep disturbance, night wandering, low appetite and weight loss, stiffness and rigidity, cognitive impairment, and caregiver distress. So really looking at all that, guys, our older adults who are taking Beer's criteria medication like tricyclic antidepressants, antipsychotics, right? Things that end up there, Flexeril, opioids, right? How many of that population is on, opioids? A lot, right? So again, cannabis can, in all these situations, people with Alzheimer's disease and dementia are often on medications for narcotics, opioids, anxiolytics, benzos, right? Antidepressants, NSAIDs, opioid analgesics, sedatives, hypnotics, muscle relaxants, antiemetics, right? Anticonvulsants, anti-migraines, antipsychotics, and even PPIs, guys. And you're looking at cannabis being a possible option because yes, it can literally help with all of the literal most problematic symptoms of dementia to improve quality of life, right? So medications that are known to increase the risks of morbidity and mortality in elderly people are often used off-label to treat symptoms of dementia because there's not a lot of alternatives, guys. And when we're looking at that, you're increasing things like fall risk, and other Beer's criteria kind of terrible things that we do not want to incur. So, looking at that, how do you put it all together? How do you dose for dementia, right? Well, in the studies for dementia, guys, THC is actually the most common dominant cannabinoid, ranging from 2.5 milligrams, that's about the smallest dose that can cause a little bit of psychoactive effects, to 25 milligrams twice a day. So in dementia, when high doses of THC were given, patients were started at lower doses and titrated up to get there, or they showed adverse effects. So in there was another study with potent CBD dominant cannabis, an average dose of THC 7.4 milligrams and CBD 175.8 milligrams administered 3 times a day, effective and very well tolerated. I heard from, somebody that I was working with, 96-year-old dad, and he doesn't have a whole lot of dementia, but again, quality of life, huge improvements in sleep and in general mood, right? So where you're looking at that, a lot of our elderly population, those who might have been, on the fence about cannabis or completely against it their whole life, tell them to do their own research because there's a little bit out there, right? And if not, tell them to give us a call and we'll get them all fixed up. Otherwise, guys, looking at ratios, high CBD to low THC ratios in the morning, right? Like 5 to 1, 10 to 1, you're looking at something like that. In the evening, you switch it up, right? Take that dose ratio down. You can even do 1-to-1s and increase that ratio in the evening, right? So very, very interesting stuff for sure. So guys, benefits of cannabis are many. And right now, I don't know if anybody else has noticed on a national scale, like cannabis kind of getting trashed, like on Twitter. Right now is the political time, so everybody's really divisive. I don't think it's like all conservatives or all, Democrats do think one way or another about it. But again, notice when you're out there on social media, when you're out there in the news, watching, seeing what's going on, how people are attitude towards cannabis. You're gonna notice still a lot of cannabis naive, a lot of stigma, a lot of cannabis confused. Those who are angry at it, I call them confused because they just don't understand. As a whole, we don't understand, but we understand it's a lot more positive than it is negative, right? And we have mass amounts of data for that. Insane. Anyways, guys, moving on. Tomorrow at the Roasted Rooster here in Las Cruces, New Mexico, got the grand opening, collecting coats for families in Barreno, on top of cans for people at the Casa de Peregrino. So Bring a coat, 3 to 7, food, fun, surprises. Get out there, support your local community, guys. After work on Friday, go by the old Waffle House. Roasted Rooster coffee and waffles, to be exact. Last things, guys, Men's Health Minute tonight. We are talking heart screenings. Men, if you're over 45 and over 30 even, or if you're of Aboriginal or Torres Strait Islander descent, you should have a heart health check. A heart health check involves checking your blood pressure and other aspects of your health that affect your risk of heart disease, such as your family history, whether you have diabetes, or whether you smoke, right? Your doctor might also check your blood sugar and cholesterol levels. If they haven't been measured in the last 12 months, that will calculate your risk of cardiovascular disease. After that, if you need to have follow-up tests, yes, fine, great. Whatever has to happen. But, for those of you in those interventional stages, 45, 30, you haven't hit dementia yet. You may not have hit the type 2 diabetes yet. Maybe in the pre-diabetes stage, you may have a little high blood pressure, so on and so forth. But hey, get on top of it now. Just saying, right? I mean, again, there's a lot of things for people to get on top of now, such as taxes, finances, personal goals, business goals, but those little lifestyle goals now, right? Where we're talking about preventing cognitive decline in the future just by moving more, by eating less sugar, by staying healthy and generally fit. You will be in such a good position, guys. Other than that, we're going to close it off for tonight. Hit me some questions if you need. Hit me in Messenger, hit me wherever, and I will get back to you when I can. Other than that, have a wonderful, beautiful